All right, we're going to go ahead and get started. Thank you for everyone for showing up. We appreciate it. Right now, Living Well is looking for suggestions on topics that would be of interest to you. Write them down, send them to me, send them to our website, Living Well website. However you want to get it to me. Put it in a bottle and throw it in the ocean. Anyway, because we need more. Yeah, that'll work too. I'm going to introduce Dana Long. She's Director of Public Relations at Medical City, and she'll do the introduction to the doctors. Thank you.
Thank you.
Thanks, Steve.
Hello, y'all. Thank you for joining us today, and thank you, Scott, for setting everything up. I think we've had enough fun trying to get everything working. You know, technology is supposed to make our lives better. So thank you for joining us. I am the Public Relations Director at Medical City Denton and Medical City Argyle.
Our bathrooms, snacks, evaluation forms
Okay.
at the end.
I guess we're going to hear two presentations at once. You guys get quite a bang for your buck.
And why they're all here today?
Next door.
I think it's a coincidence.
Yeah, it's one back there. So just a little bit about Medical City Denton. It has been in this area for about 30 years under some different names. And before that, it was Westgate. And before that, many of our physicians were at Flo Memorial Hospital.
Michigan University.
So if you have done any of those types of things, been in the area for a long time, we've been part of this community. Medical City Argyle, as you know, we just purchased that about 2 years ago, and it was part of Wise County Medical. And we're continuing to do different things with Medical City Argyle, but I know that that's kind of your hospital. My folks live here, or have lived here for about 10 years. You know, it's like coming in for both ears. I'm sorry about that. My part isn't as important as Dr.
Can you
Rizzi's.
hear me? Am I on?
Oh.
How can you know? Or if you don't like what I say?
All right. So Medical City Denton is the only level 2 trauma hospital in Denton County right now. And we serve people all the way up to the Red River, across the river, into the casinos. So we bring in trauma patients from all over. We're also a Cycle 7 chest pain center, which means we're a top level, the very top level for heart attack, cardiology, stroke, all of those types of care. So we're here to take care of you. The only thing we don't do is labor and delivery. So if you're in the market for that, I'm really sorry.
You gotta worry about that.
They do in the women's center. You hear crying babies every time I go in for PT.
I'm not sure why you hear crying babies, except for we do help with a clinic that's for lower income people, and a lot of them bring babies with them. So that might be part of it. I don't know, but we don't have babies. One of the things I tell people, and it's just kind of in fun, is I have some pens back there, and I tell people this is a cognitive test. If you picked up a
I
pen,
know.
I ask you, how does it work? Because I don't want you to think that it's broken when you get home. It's not the top thing, and it doesn't twist. It goes like this.
Yeah.
All right? So don't think it's broken. Keep it. All right, so now I'd like to introduce you to one of our interventional cardiologists at Medical City Denton. He's been here as long as I've been in the hospital.
15 years.
15 years. Dr. Cameron Risby. He is our expert on pacemakers and fainting and falling, and he's going to explain to you why those are associated. So I'm going to let you talk with him, and then we'll do a little Q&A afterward. I'm sure he'd be okay. If you have questions during the presentation, if you want to raise your hand, I'm sure he's okay with answering them as you present. And after that, we're going to have some more information about falls, because I don't know if you know this, but the most common accident that we see in the emergency room are ground level falls. So that's why we want to make sure that you stay as safe as possible. And Dr. Risby, I'll let you take it away.
Thank you, David. Yeah, it is a real privilege to be here with y'all. Really, I mean that. And I have many patients that live in Robeson Ranch, so I'm scanning the room to see if I recognize any patients. So yeah, seriously, I just love working with this community and the folks here, and it's really an honor. Okay, so Dana asked me to speak, and I know the topic for today is kind of fainting, also falling, fall prevention. So, I was asked to speak because there is an intersection between fainting and falling, and it deserves attention because, at Medical City Denton, we have a trauma program. You may not know this, but if you have a serious trauma, car accident, ground level fall, we are the only trauma center, level 2 trauma center in this area, which means we basically take care of accidents. And we're really kind of the go-to spot for folks in Denton County for that. And we're proud to do that. I get called a lot because from the trauma service, they have patients that come in with a fall, broken hip, head trauma, black eye. And the trauma surgeons and the trauma team are excellent at taking care of the orthopedic issues, the bleeding issues. Essentially, they do that part fantastically. Where I get involved is I'll question the patient and I'll find out that they actually, they didn't just trip on a rug, so to speak, but they blacked out. They lost consciousness. And man, that's hard. That music is hard. This is a new one. I'm going to actually just step away from the wall a little bit. And there we go. Just so it's not in my ear, because I think it's also getting into the mic. So, yeah. So I get called a fair amount for, there we go. Got it. Thank you. So I can think of one patient of mine. He was in a motor vehicle accident. Had severe trauma, but got better. I looked at his EKG, and he had a very abnormal EKG, suggestive of a patient that was probably from time to time having a really low pulse rate. So for that patient, yeah, we fixed the broken bones, but this was going to happen again unless we put in a pacemaker. So there is a commonality between both diagnoses. So the first part of this talk for today is going to be more me focusing on fainting. And I'm going to talk about, in particular, some of the cardiac reasons why people may faint. And then Carrie is our nurse with the trauma team. She's going to talk about falling, fall prevention, and what are some of the services we offer as far as that goes. Does that sound good?
Yeah.
All right. All right, so I'm going to start by telling you a little bit about myself. So I've been in this area for 15 years now. I've been practicing, I think I'm the longest continuous tenant in the professional building at Medical City now. I actually grew up in New Orleans, went to Tulane for college, was then in Chicago. I don't know if any Chicagoans in here, but I was there for 7 years at the University of Chicago. Then I came to Dallas for training, actually, at the University of Texas Southwestern. That training also took me to Parkland and the Dallas VA. So I don't know if we have any veterans in here, but any veterans in the room? All right, thank you for your service. Yeah, so I worked for 2 years at the Dallas VA. So then I went to Salt Lake City. I did EP training. So what is EP? EP is an additional specialization on top of cardiology. So an additional 2 years where you just focus on the rhythm of the heart. And I'm going to talk a little bit about that. And that's where I kind of got into working with patients with fainting or syncope. So let's talk about the issue of fainting. So syncope is a fancy term for fainting. And syncope is really defined as a transient or temporary loss of consciousness, okay? Usually lasting a few seconds, maybe a few minutes. It is associated with a loss of tone. In other words, you go limp, right? You fall, you faint. And it's associated with a rapid recovery. and then afterwards you kind of feel like yourself again. You might feel a little worn out or tired, but there's no like prolonged period where you don't feel well, okay? So fainting is clearly defined as a transient, temporary loss of consciousness associated with recovery and a loss of tone when it happens. So what is not fainting? A seizure is not fainting, because after a seizure, usually you have a post-ictal state, you're kind of out of it for a while. Falling asleep on the couch and waking up 10 hours later, that is not fainting. That's just being sleepier. If it happens during the day, it could be narcolepsy. So fainting is a temporary loss of consciousness. It is very common. Okay, we see it all the time in our emergency room. It is one of the top 6, I think more top 5 causes of hospitalization. On average, a patient with fainting will spend like 2 or 3 days in the hospital, so it's a big kind of aggravation. Of all the people in this room, 1 and 2 will faint over the course of their lifetime, so it's really common. Any questions so far? Yes, sir?
Is it similar to TIA, same thing?
Yeah, TIA is a little bit different. They're related. So TIA is when the brain has a little mini stroke, it's not getting enough blood. A TIA can cause a loss of consciousness, yes. But they're like apples and oranges. They're different, but they're related. So, yes, ma'am?
Is vomiting common with it?
Absolutely. That could be one of the, so we'll talk about that. Okay, so, I mentioned fainting can be a major drag. Basically, you can, on average, patients will see like 3 different doctors before they're diagnosed. Doctors a lot of times have trouble diagnosing this. It's one of those areas where there's a lot of physicians that are really not comfortable handling this. So sometimes you're seen by your primary care physician. He's like, I don't know what's going on, go see a neurologist. The neurologist says it's not a seizure, go see a heart doctor. And so it's a lot. Yeah, we'll talk about what's the most common causes. That's a good point. It depends on what causes it. So my goal when I got interested in fainting was really to be a resource for the community, for the management of patients with fainting, and really to focus on the right diagnosis at the right time. So what are some of the causes of syncope? Well, there's a lot of them. So the most common reason why people faint is actually called a common faint. It's also called neurocardiogenic syncope. It's also called vasovagal syncope. And that is, frankly, the most common reason why people faint. And what that is, it's a reflex. A reflex is involuntary, right? All reflexes are involuntary. So there's a reflex where, imagine, someone in a marching band on a hot day in a parade faints because of heat stroke. Or you're in church on Sunday morning, there's no ventilation, kind of like this room, there's no ventilation. It's hot, there's a lot of people. You haven't had anything to drink. And you faint. So I see patients that faint at church. I see patients that faint in line at Walmart, checking out the register. So that is the most common reason why people faint. That is called a simple faint. That is thought to be triggered by a nerve in the body called the vagus nerve, like Las Vegas. And the vagus nerve can detect when there is decreased blood flow to the brain, and it causes your body to shut down, and that's why you go flat, right? When you faint, you go flat. Now gravity is not working against you. Now blood can go to the brain. Yes, sir?
What do you recommend to a person watching that happen?
A person that happens to?
No, I say, what do you recommend when your partner or somebody next to you starts fainting?
Yeah, exactly.
What should you do?
Yeah, so that's a great question. What should you do if your partner or someone near you faints? The very first thing I would do is lay them down, and if they're slumping down in a chair, grab a hold of them, gently put them down, turn them on their side, because it could also be a seizure. You're not exactly sure what's going on. I would feel for a pulse, actually. Feel their wrist, feel their throat, try to arouse them. And then kind of need to call 911 and do CPR. So that's a broad, But if it's just a simple thing and there's nothing more dangerous going on, then the main thing is lying down flat, get horizontal. And a lot of times you can avert a full-blown faint. A lot of times if you get down, you can avert loss of consciousness and elevate the legs. So put some pillows or a chair underneath their feet, and that'll force that blood to go back to the brain. And have someone grab them some water or some salty snacks, and kind of try to rehydrate them while they're still down. What you don't want to do, if you're next to a patient that faints, a simple faint can happen in clusters. So you can have 2 or 3 episodes in one go. So what can happen is you can faint, black out, and your friends and family, they're like, oh, get back up, you'll be fine. And then you go down again 5 minutes later. So once it happens to you or someone you know once, you got to take it easy for the rest of the day and just stay down for a while until you're back to feeling good. Okay? Does that answer your question? Okay. So we talked about the most common reason why people faint is a simple faint, right? That's what it's called. Simple faints are not thought to be predictive of a worse prognosis. In other words, patients that faint are at no higher risk of life-threatening events than people that don't faint, okay? Provided it's a simple faint. If it's a simple faint due to that vagus nerve, that is a benign thing. It can cause morbidity because you can fall, it'll break your hip, hit your head, but it does not cause mortality. It's not like a life or death kind of thing. There's other types of fainting that we worry about much more, okay, in terms of life or death kind of. And that's kind of when I get involved. So fainting can also be due to cardiac causes. And those are not just simple faints. Those are faints that really are a harbinger of a life-threatening risk, essentially. So we take those very seriously. If we have a patient that faints and we will suspect a cardiac cause, a lot of times for those patients, we need to do further testing, like a stress test or an ultrasound of the heart or a simple EKG to see if we can tease out those people that are at higher risk. Especially in an older senior citizen population, medications can be a big cause of fainting. So are anyone in this room on high blood pressure medications? I see a lot of hands going up, right? How about like water pills or something similar? Yeah, I see that too. So all of those things can cause orthostatic intolerance. Orthostatic intolerance is when your blood pressure goes low with changes in position. It's called orthostatic. You'll especially feel it right when you get up from a seated position. Some patients will notice it when they're laying down, they get up, they walk a few steps, and all of a sudden they're like, whoa, I'm about to go out. If you feel that, that's almost always orthostatic. And a lot of times you're going to have to speak to your physician about, hey doc, I'm not feeling well. You just started me on this blood pressure pill. I think it's making me dizzy. And so that is another thing that we do see is medication related. Neurologic causes, you were asking what kind of specialist is the right one to see. Well, if it is a neurologic cause, it's going to be a neurologist, right? And they're going to probably do an MRI of the brain, make sure the brain's okay. They're going to check to see if you have seizures. Sometimes they do an EEG. And then if need be, they will put you on medication for seizures or stroke or TIA, whatever it is. Okay? All right. Oh, and this is important. A third of the time, we can't find a diagnosis. In the world of fainting and falling, you have to just get used to that. That is part of the world we live in. A lot of the times, there's no clear diagnosis, and that is a fact. But that's about a third of the time. Most of the time, you can still figure it out. Okay. Yes, ma'am.
My daughter at 37 fainted. Didn't realize it was a problem. We didn't do anything. We were out. She fainted again, and she never came back.
Oh my God.
So it's really important that when fainting occurs, it's checked out.
I'm so sorry. Yeah, I take fainting very seriously. Yeah, I did not brush that off, and man, I'm sorry for your loss. That is tragic. I do want to talk a little bit about the kind of work I do. I do a lot of pacemakers. Because a lot of times fainting is due to a low heart rhythm. It can also be due to a fast heart rhythm. And it is important, especially when I hear that about your daughter, I'm thinking immediately light bulbs going off. I'm wondering if she had a cardiac arrest, is what it sounds like.
Probably.
Yeah, definitely not a simple faint.
Right.
Yeah. Pacemakers are devices that go under the skin. They treat a low heartbeat. So they're very simple, actually. They keep the heart going. It's like a backup. Pacemakers are really good if you need one, okay? The patients that need one have a low heart rate associated with symptoms. Not just a low heart rate, because athletes have low heart rates, right? That doesn't mean they need a pacemaker. But it's a low heart rate associated with symptoms. So fainting, near fainting, dizziness, lightheadedness, severe fatigue, falling asleep during the day, that kind of thing. Pacemakers can help patients feel better. They can help prevent fainting spells in the right patient. Defibrillators are kind of like pacemakers. Every defibrillator has a pacemaker built in. A lot of people don't know that. You get a pacemaker for free when you get a defibrillator. But a pacemaker can do something additional. It can actually shock the heart, like in the movies. It can shock the heart, and it can be a lifesaver if in the right patient. The third device is called a loop recorder. So think of that like a heart monitor. I don't know if some of y'all have had your physicians order heart monitors. They are stickers that go on your chest. They record all your heartbeat. Those are short term. You wear it for a day, 2 days, maybe a week, maybe a month. They're very aggravating because they can cause a rash. They fall off, this and that. A loop recorder is like the best heart monitor you can get. It's a chip. It's the size of a paper clip. And it's actually injected with a pen underneath your skin. And it can record your heart rhythm 24/7 for up to 4 years. So it's like the creme de la creme heart monitor. And that can help diagnose the cause of fainting in patients that have episodes once in a while. You know, if you're like, oh, I fainted a year ago, and then I fainted last week, you know, the episodes are happening once every 2 years. A short-term monitor is not going to show anything. What you really want to know is what's the heart rhythm at the time of the faint. And a loop recorder can help make that diagnosis. This is just a quick overview. I just want to remind everyone the heart is an electrical organ. Okay, so the heartbeat starts at the top of the heart. That's called the sinus node. And that beat goes throughout the heart with these nerves. Okay, they're nerves that are responsible for sending the electrical impulse throughout the heart. Any part of this diagram can be affected, right? You can have problems here where you don't have enough heartbeats. You can have problems right here in the middle. This is like the junction box of the heart, the AV node. Sometimes the AV node stops working, and then the beat doesn't go down to the bottom. So all of these things can be affected. This is a brief overview of pacemakers, just for informational sake. They haven't been around all that long. 1950s were the first pacemakers. They were actually plugged into an extension cord into the wall. It had a drive line, but it kept people alive. Then they basically they became battery powered, but you had to wear it like a vest. So you wore the pacemaker. This was like a child here with one. And 1958 was the first completely encapsulated pacemaker that goes under the skin. Not that long ago. The most recent models here in the last 10 years, they have wires that go into the heart and the device goes under the skin. The device is made of titanium. The latest pacemakers are pill-sized, so they're about the size of a multivitamin actually. They go under it. Yes, ma'am.
I have one in my heart.
The pill one?
Mine's in my heart.
Yeah, that one.
Like cardio.
Yeah, you got the new one.
Yeah.
Yeah, you got the new one. Now, not every patient needs this kind. There's certain people that really need the traditional one, but this one's really slick. This one's really good also. So, in the future, they actually may be without a battery and they just recharge kind of like a mechanical watch. It just recharges with your wrist. So in the future, they're working on pacemakers that, because the heart beats 100,000 times a day. I don't know if you knew that, but 100,000 times a day. So they can harvest the energy of the heartbeat and recharge itself. So yeah, one pacemaker will last a lifetime. So currently they last about 10 years.
I was gonna say they last about 10 years.
Yeah, about 10 years. Yes, ma'am. Okay, so the reasons to put in pacemakers are symptoms, so patients that are fainting. This is, I talked about that neurocardiogenic. It can help prevent AFib, and in some patients, they're on medications that actually slow down their heart, like beta blockers, and those are very common medications, something called metoprolol, carvedilol. And sometimes a pacemaker will allow the patient to actually take the medication without making their heart go too slow. So it can be used as an adjunctive therapy to allow people to take medications that they really need. See how we're doing? Okay, I'm going to wrap up here pretty soon. The pacemaker goes under the skin. The wires go down to the heart, one to the bottom of the heart, one to the top. So that's kind of a schematic. Pacemakers can be monitored from home, which is really nice. All the new ones are MRI compatible, which is a big deal if you ever need an MRI. And the battery lasts about a decade. This is that new pacemaker that we were talking about? Yeah. That's a multivitamin. So it's about the size of a multivitamin. It sits inside the heart. There's no wires. It's the battery. Yeah, and I have put these in. Defibrillators like a pacemaker. It can do everything a pacemaker can do. It's an insurance policy. It can protect you against a life-threatening heart rhythm. It's like a defibrillator, but inside your chest. This is that loop recorder device. The number one reason to use this is patients that faint. So it can help diagnose the cause of fainting in patients that have unexplained fainting. It's also used to monitor AFib, to look for causes of a stroke. All right, and just in summary, I wanted to let you know that we are very active with our cardiac program in Oklahoma City, Denton. I personally do more pacemakers than anyone else in the county, and just wanted to say thank you to everyone for giving us the opportunity to speak here today, and definitely tune in to part 2 of this presentation, because that's going to be a lot of practical tips to avoid getting hurt with faint or a fall. Okay, and I'll be happy to take any questions. Yes.
Pill size pacemaker, since it's inserted into the heart, how long does that last? What is the rechargeability of that?
Yeah.
How does that work?
Yeah, so they last about a decade, which is really good. Currently, they're not rechargeable. So there's 2 options. You can put a new one in right next to the old one. It'll just sit right next to the old one. Or there's one vendor where you can actually retrieve the old one and then put a new one in. Yeah. So, but the current ones are not rechargeable.
So it's not floating loose, it's in the muscle?
Yeah, it's got, imagine fish hooks. Yeah, they call them tines. So it's got tines that grab onto the musculature. The heart, the inside of the heart doesn't have any nerve endings, so you don't feel that. But so it grabs onto the musculature, and then you set it at a speed of 60 or 70, and it just keeps the heart nice and steady. Yeah. Yeah. Great question. Yes, sir.
The majority of blood pressure issues are hypertension, and as we age, a lot of us get hypotension. Could you just give me a two-minute update on hypotension?
Yes.
That causes a lot of pain.
Yeah, I agree. Hypertension is a major issue, especially in an elderly population. To me, I mean, if you look at the latest research, in patients above the age of 80, around that range, there is more harm from low blood pressure than there is from high blood pressure, if that makes sense. High blood pressure is a big deal in your 30s and 40s, right? It's a silent killer. But in an older population, I really worry about the side effects of the blood pressure medications. In women, it can cause urinary incontinence. In men, it can cause men and women, low blood pressure, it can cause fainting. A lot of the blood pressure medications tend to be higher dosages than are really needed. And a lot of times I find myself reducing the dosages. And I will allow for the occasional 140, 150 blood pressure reading. I would rather have that than have 80 and 90, you know. The damage due to high blood pressure when it's just like mildly elevated, that damage takes place over decades, you know, not over months or years, even more over decades. The damage of low blood pressure, you'll notice that day. So, yeah. So we allow for lenient blood pressure control. We still don't want it above, 170, 180, but 140, 150, we let that slide. Yeah.
For someone on no medications, what is the indicator for the low blood pressure that we should be concerned
No medications? Okay, so for that, I try not to target a number. It's more like how you feel. Like if you're feeling faint, dizzy, lightheaded, really weak, then that's a problem, right? So there are some patients, they run low. They're always, in the hundreds, 105 over 65, and that's just normal. 90 over 60, that's low. Yeah, I would say if that's like your normal, your whole life, see, that's what I was asking. So you're probably used to that, right? You probably feel okay with that. So 90 over 60 for someone like that, someone like you, would be okay. You're not going to overreact to that because that's your whole life. But for someone that runs high, that would be a big deal. Yeah. Good question. All right. You're really going to want to listen to Carrie because she's going to help you with fall prevention. And as much as I like my presentation, I like hers even more. So thank you for your attention.
Thank you. My name is Carrie Lawson. I am the injury prevention nurse at Medical City Denton. My whole role within the trauma team is to make our community safer. I always like to say I'm trying to work myself out of a job because one day I'd like to retire and know that my job is complete. So that's what I'm here for. Like they talked about, we are a level 2 trauma center, and I want to talk a little bit about what that means. That means we can take care of any kind of injury except for broken eyeballs. We don't do broken eyeballs, and we don't do burns. We would transfer those to our sister facility at Medical City Plano. They are a level 1 trauma center. The leveling is kind of different. The lower level trauma center, the higher capability they have. So the highest level of trauma center, the highest capability, is a level 1 trauma center. Really the difference between a level 1 and a level 2 is level 1s are required to have research, academics. So they constantly have residents, they're putting out paperwork, they are doing all of the educational advancement in trauma. As a level 2, we have all of the capabilities to take care of those highest level traumas. We just don't have a full-time residency program for physicians, and we don't put out research. So I just always like to lead with that to let you know that we have that comprehensive care here local. We pride ourselves on the fact that we take care of so many local people. We get to take care of you when you're close to your home, close to your family, close to your support system. That's extremely important in recovery, so we want to make sure that we are keeping everybody involved. Maybe? Let's see. Well, there we go. So a little bit about what we see at Medical City Denton. We see on average about 4,000 trauma patients a year. So that's anything from a ground level fall, maybe you slipped, tripped, you fell over, or a massive mass casualty incident. We take care of all of that. As you can see, falls is the dark blue area of my pie chart. That is our bread and butter. That is what we take care of more than anything else. is taking care of anybody after a fall. I always like to bring in some local data as well. So here in this zip code, 76207, in 2024, we had 87 trauma patients. 45 of those were falls. So half of those trauma patients were falls. It is a very common thing, and my goal is to help prevent that. Oh, again. There we go. So just a little bit about fall statistics. I'm not going to go over all of this because this is the boring part, but falls impact us every single day. There is a death in the United States every 20 minutes from a senior or an older adult that has had a fall.
See if I can get
Just again, some local data in Texas. The data shows that of seniors 65 years and older, 29% of those will fall.
Can you go back to that another?
Absolutely. There we go. This one? So this is just a map of the United States, and it shows fall percentages. And here in Texas, we actually have a little bit lower than the highest areas of the United States. However, we still are a little above the average at 29% of adults 65 years and older falling.
So Florida doesn't have as many falls.
They don't, or they're not recorded. Yes, sir.
That statistic, is that those just that presented a hospital?
Correct. Mhm. Yes. All right. So Dr. Risby already talked a lot about this, why falls happen, so I'm just going to breeze through this pretty quickly. There we go. Medication interactions, he talked a lot about. I do always like to point out that this is why having a primary care provider is so important, because we like to think we all have our own specialist, but the primary care provider is the umbrella. So they're the ones kind of like controlling all of the specialties, making sure that your cardiologist is talking to your electrophysiologist, and who's talking to your nephrologist, and making sure that all of our medications are not causing more problems. So that's why having a primary care provider is really important. I should have checked the battery in my clicker. This would have been easier. Vision, so making sure that we are getting our eyes checked every year, making sure that we have appropriate prescriptions if we need them, cataracts if they do occur. All right, and then the most common injuries from falls. Far and away, the most common thing we see is broken hips. This is very common. I would say most of our fall patients that come into the hospital, if they have an injury, it is most likely a broken hip. So then we want to think about the recovery process. So you're going to have surgery, physical therapy, a rehab stay. It's quite a long recovery. So this is why we want to do things on the front end to try and prevent it. We do often see head bleeds. So we consider a head bleed anything if you fell and you had a head strike. So someone talked earlier about what would you do if a partner fell or you witnessed a fall. The one thing that I would want to know is, give me a roundabout time that it happened. Did they hit their head, and did they lose consciousness? Those are going to be big things that, as a trauma provider, we want to know, because that's going to address how we handle this fall. It is very common if you have a head strike that something gets jostled around in there and we develop a bleed. So we want to make sure that we're taking care of that appropriately. And then as we age, we lose elasticity and collagen in our skin, so we often see skin tears, lacerations, cuts, things like that, that require some wound care as well. All right, and then I want to talk a little bit about the cycle of falls. So oftentimes, when a fall happens, we go through the recovery process, and that makes us a little scared of falling again because none of that is comfortable. Breaking your hip is not a pain-free event. The recovery is not a pain-free event. And so then it sometimes scares us and makes us not want to be as active as before. But unfortunately, when we're not active, that increases our risk for falls. Exercise is a huge, huge prevention technique. I'm just going to come up here. This is easier. Well, maybe this is easier. There we go. So lack of exercise, not only does it reduce your cardiovascular status, we're losing muscle tone and muscle strength every day. Exercise is great for building up our bones, making sure that our bones are staying strong and healthy, especially as we age and things like osteoporosis come into play. So exercise alone, that activity and movement is honestly one of our #1 ways that we can prevent falls. And that's because we're making sure that we're staying active, we're keeping our flexibility, we're staying mobile. If somehow you end up on the ground, you are able to lift yourself back up off the ground. So different types of exercises. We focus on cardio. So again, strengthening our cardiovascular system, but muscle training. So strengthening exercises, making sure that we are really keeping our muscles up as we age. They tend to atrophy. And then there are things that we can do in the home to prevent falls. So things like in the kitchen, making sure that your most commonly used items are at waist level. Try not to have things stored up so high that you have to get on a step stool or a chair. We see that often. Please don't ever use a chair for anything other than sitting. Maybe as a balance aid when you're standing. A chair is not a ladder. We often see people climbing up onto countertops to reach the top. Please don't do that either. So if it is possible, your most commonly used items, keep those at waist level or below, an area where it's easily accessible to you, where you're not having to reach really high or bend down really low to get to. Around the house, having night lights is a great idea. I know I have a 10-year-old son, and he likes to leave the lights on, and it drives me bonkers because he's not the one that pays the electricity bill. So I always tell him, turn the lights off. But we have these little night lights in our outlets for a reason. We aren't going to fall, we're not going to trip on something. We have those lights available. Just the same, making sure you have a night light in your areas, especially nighttime going to the bathroom. That is one of our #1 causes for ground level falls, is people are tripping in the dark into the bathroom. Rugs. Rugs are a big one as well. So if you absolutely have to have a rug, I am one of those people. I do not like my feet on bare hardwood floor, but I do not want carpet either. So I have to have rugs available. There are grippers that you can put onto rugs to make sure that they stay in place. There are sticky ones, there are ones that are just kind of like shelf paper that don't stick to the floor or the rug, but they do provide enough friction that they don't move around. And then just removing clutter. That's going to be a big one, making sure that you have clear airways, clear walkways. I mean, I do want you to have a clear airway as well, please do that. But having clear walkways so you can move around your home. If you have small animals, they are very much a part of our family, but try and train them so that they're not getting underneath your feet. I know that's very hard because they love you very much, but if we can. So this is just an example of a sticky that you can put on a rug You can find stuff like this on Amazon. It is all readily available. Don't walk around with a corded microphone. That's also a great fall prevention technique.
There it is.
Cords, electrical cords. So if you have any lamps, anything that's stretching across, try and do what you can to either, put those cords underneath a rug that is, stuck down to the floor, or put it in a corner along a walkway. Just get that cord out of the way so that way you're not going to trip on that. Chairs. I always like to point out, chairs like this are very beautiful, but they're a little bit more difficult to get out of than a chair with an armrest. So if possible, try and use a chair with an armrest. Not only does it keep you a little stable side to side, but it does give you that balance when you're getting up. If you have stairs in your home, I know it's not the most attractive, but if you can put some reflective tape down, especially carpeted stairs, they just kind of blend in with each other as you're going down. But if you have something on the edge that just gives you that visual cue that there is a difference, so that way you don't trip going up or down the stairs. Our bathroom. Our bathroom is a very dangerous place, but it is the most commonly used place in the home. So if you can have handrails in the shower, a shower stool if you need it. They make the handles that go over a toilet. Again, just like the chairs, the toilets tend to be very hard to get off of, especially if you don't have a stable sink or something close by to balance on. But you can grab handles to push yourself up and down off of that toilet. That is going to be your best friend, because we often see after going to the bathroom, especially with a bowel movement, that can trigger your vagus nerve that Dr. Risby was talking about and cause a syncopal event. And then when people get up, they fall down. So just a little plug into Dr. Risby there. Our bedroom, making sure that we have adequate light. Again, getting up to go to the bathroom in the middle of the night, have a lamp available, have night lights available. And then while you're getting dressed, if you need help, make sure you have that help available, or you're close by something that you can balance on, especially getting those socks on, pulling those pants on. The things that you're going to have to bend over for, just make sure that you're either, one, sitting down, so that way if you fall, you're not falling far, or hopefully falling back onto the bed, or two, that you have someone there to help you. The kitchen we talked about. If you do need to use a step stool, make sure that it has a wide base. We often see, just the little square step stools. Unfortunately, those are, they're just not very stable. When you're trying to get up and down off of them, they tend to wobble a lot, and we see lots of falls from that. High gloss floor wax. We don't really see that often in residential areas, but like in grocery stores where you see their floor has just been recently waxed and it's so nice and shiny, looks very pretty, it's very slippery, so we don't tend to like those. And then a couple of things that we as a hospital do to help prevent those falls. We have two programs. One is called SAIL, Stay Active and Independent for Life. It is an exercise program that we offer at Denton Village. Okay, I always get confused if it's Denton Village or Lake Forest, but we offer that at Denton Village 2 days a week, twice a day. So Tuesday and Thursday, morning and afternoon. It is a class that is put on by our physical therapist. You come, we give you a physical assessment, and then it is a continual class. Every 6 months, they do another assessment to make sure that, one, we're doing appropriate exercises to you and making this benefit your life, but two, make sure that we are providing you adequate things. Are we actually giving you the appropriate exercises? Is this actually benefiting your life? Are we seeing a difference? And then the second one we are starting next year is called Bingo Size. This is one that I will be leading. It is an exercise program, but it is a social activity as well, which is why I wanted to do it. It's actually a bingo game. So we incorporate exercising into bingo activities. And this will also be a twice-a-week class. And it is a 10-week class, but we will offer it throughout the year, just like our sale programming. Yes, ma'am?
Do these programs have to be, do you have to have your doctor recommend you so that Medicare pays?
No, ma'am. Both of these programs are free. Free for everyone. So if you want to come, we would love to have you. You can get that information. This QR code, you can scan it with your phone, or I have a paper at the back table that has this QR code on it as well. It also has my contact information, and you can call or email me, and I can sign you up for either class, whichever one you would prefer, and we can make sure that you're taken care of. Yes, ma'am?
Does the sale program include instructions about how to get up and down off the floor?
Yes, ma'am, it does. Both of these classes actually talk about if you fall, how do we get ourselves back up again?
Thank you.
Yes, ma'am. Any other questions?
How often do you do these?
So both of these classes are 2 days a week. Bingo Size starts in 2026. Sale is continuous, so it is going right now. And both of these programs, it does not matter if you come in on a start date or just a random Tuesday. We will do the assessment and we will get you in and get you going. Yes, ma'am?
Could you talk about the safe height of a bed to get in and out? Because I know people who use a step stool, 2 steps to get up into their bed.
Yes. If you need a step stool to get into your bed, it is too tall. I'm just gonna say that right there. Ideally, if you can get it to mid-thigh, so that way when you are sitting down, you are having a good portion of your buttocks on the bed, so that way if something were to happen, you are already on the bed. But anything higher than that, if you need a step stool, that is too tall. That would be a rough fall off the bed too. I don't know how I could go to the bathroom in the middle of the night. I'd fall every time. Any other questions? Thank you so much for having us out here. If you have any questions, like I said, my information is back there. I am always available. Whatever I can do to make you safe, I will. All right.
Thank you, Carrie. And thank you for sharing some of the new programs that Bingo Size. Sounds fun. All right, so that's the conclusion of our formal program. I'm here to answer any additional questions you have. I have Scott Tellez in the back. Scott's over our ER at Medical City Argyle. Some of you may have visited it. Scott says that we have a lot of falls that come into Medical City Argyle. So he's here, or his folks are here. We're there to take care of you.
What can you do in the house to practice keeping your balance?
Carrie, I'll have to ask. What can you do in the house to help keep your balance? Learn to keep your balance.
If you have a walker, please, we do want you to use your walker. But also, if you have chairs, you can place them along your walking route and have sturdy furniture that you can use to balance on. We would much prefer you have a walker that you are comfortable, or cane, whichever device that you use that in your home though.
Okay. All right. Well, if you need us, we are here. We're Medical City Denton, Medical City Argyle. We also have 26 hospitals total in the DFW area, and we are part of Care Now. So Care Now will refer. There's one at Razor Ranch, and there's one over by Medical City Denton. Yes.
You don't have the facility for the exercise in Argyle.
We do not have the rehab center at Argyle, the big building. We don't have that at this time. We've gone to a different model for rehab services, and Vista is the one that we've been working with, and they opted not to put that back in. We did just add a mental health clinic, though, up in that facility right next to Medical City Argyle. And if you need mental health, Alzheimer's, dementia, autism, those types of things, there is a clinic that's just opened about a month ago over there, and it refers into Medical City Alliance, which is straight down the road down this way. Thank you all.